On social media, many of the claims about the COVID vaccines are based on dubious studies and false claims.
Well, maybe this is going to make you infertile, or maybe there's a chip in it, or maybe it's going to make you magnetic. All those things are out there with absolutely no evidence. So please, people, if you're still holding back because you've heard some of those things, just hit your own reset button and look at the actual evidence.
But while that's a leading cause of confusion, legitimate scientific research and leading scientists have also caused some confusion by saying something and then saying something different. For example, when the pandemic started, the World Health Organization said wear a mask only if you're sick.
And if you're not sick, you shouldn't be wearing a medical mask.
People should not be walking around with masks.
But for context, that was before research showed masks help prevent spread, and before scientists discovered how people can catch and transmit COVID to others before they have symptoms and even know they are sick.
What else can they possibly do?
You know what I think they should do? Just wear a mask. You go to the CDC website. There are ample references to studies showing the beneficial effect of masks in preventing acquisition and transmission.
And when you see scientific studies that appear to conflict on other points, the same thing is generally happening. As our understanding of the virus improves and more data comes to light, recommendations can and do change. That's the nature of science.
Well, I heard it said really well once that, in December, people are recommended that they should wear coats, but in June, not necessarily. The environment changes sometimes, and sometimes the recommendations do along with it. And so it's important for people to keep in mind, as we move through this, we're always taking actions based on the best information that we have that applies to the environment at that time.
Which brings us to what we now know about wearing masks. Federal research shows schools that require masks have had more success in fighting COVID-19 than schools that do not. One study found student infection rates increased more in schools that did not require facial coverings. And another study in Arizona found COVID-19 outbreaks were 4 times more likely to occur in schools that did not require facial coverings when schools reopened. Researchers also examined 30 studies around the world and tied mask wearing to a 53% reduction in COVID-19. On vaccines, the science and research show they do provide protection to varying degrees against infection, serious illness, and death, and are safe and highly recommended for women who are pregnant.
The CDC is tracking tens of thousands of people who are pregnant and now delivered, and there is no signal that there is any concern there at all. That's why the CDC, as well as the 2 largest women's health doctors associations, came up strongly recommending that pregnant people get vaccinated.
Our nation's experts also say the research on protection from vaccines versus protection from natural immunity also needs to be put in context for people to fully understand.
To those who say they don't need to get vaccinated because they've already been infected from COVID-19 and recovered from it and therefore have natural defenses, you would say what?
I would say I understand that, and maybe we have been too quick to dismiss that as something insignificant. That is significant. That provides you with some pretty good immunity. But you know what? If you then get the vaccine on top of that, then you've got the kind of immunity you can really count on. There's lots of people who got COVID once who are getting it again. And if you had COVID and then the vaccine, you're much less likely to have that kind of a recurrence.
And when you see the studies on vaccine protection versus natural immunity, Dr. Cameron Webb says also pay attention to what they show in terms of durability.
We know that natural immunity, it does protect people for some period of time. The durability of that immunity is less certain. I think there's, the value of the vaccines is that one of the things we've seen pretty consistently in studies is it seems to offer more durable immunity to a larger group of individuals. You have higher antibody responses that last a little bit longer, and that's also the value of boosters. So the better part of valor here is that the vaccination is a little more predictable in terms of what its impact on you is going to be, but also in terms of the antibody response.
Craig Patrick, Fox 13 News.